All right, guys, so next ones, we have the one joint rule and proper bracing technique. So both of these, and more so the one joint rule, we borrowed from Kelly Starrett in his terminology. Kelly Starrett just wrote this book called The Supple Leopard, or Becoming a Supple Leopard. Just talks about movements and stuff for proper techniques of lifting and all this kind of stuff. The one joint rule, what we mean by that is when we're looking at your spine and we're looking in a squatting pattern, we want to see only one joint moving. It's either the hips or the shoulders, the joints above and below the spine. We just want to see one joint moving. And we want to keep your spine essentially stable and neutral. So it shouldn't be in flexion or extension, right? We want to keep the spine loaded but stable, okay? So in the spine you have, it kind of looks like an S curve, right? And that's the posture we want to keep it in. So I'm going to look from the side here, and if you guys see my spine, I'm going to show you, so this is cervical, flexion, extension, right? This is neutral, this is where we want to keep it. Flexion, extension should not be happening in squats, okay? So thoracic, flexion, extension. Sometimes we protect the shoulders, we'll move our thoracic spine a little bit. We want to keep that nice and neutral as well. And then lumbar, of course, we have hips, right? And so this one we call anterior pelvic tilt, posterior pelvic tilt. We don't want to see either of those happening. So when we're squatting, okay, I want to see a squat. Again, my spine, I'm going to move my hip joint, but my spine is not going to move, okay? So I'm going to squat here, boom, moving my hip joint. My spine should not have moved. Stable in the cervical, right? It's moved. All that's moved is this joint right here, but not my spine. What happens if you come down, the one joint rule, if you're moving this joint, cool, but then if you start to flexion, all of those facets or all of those vertebral joints are moving as well with it. We don't want that because that's going to decrease your stabilization and for the spine. And sometimes it's an issue, just maybe hamstrings are tight, hip mobility is not there. We'll fix those things and we'll cue those things for you so you see them and you understand them. But quite simply, one joint rule, make sure the joints above and below the spine are the ones moving when you're doing the movement and not the spine itself. Another common one is the press. So when we get into a shoulder press, sometimes what you'll see is your rib cage going up, boom, that's my thoracic spine moving. So sometimes people don't have a good flexion and extension in their shoulders, right? And we want you to get full extension on that shoulder. If they are trying to get full extension and they're getting up there, but they're having to bring up their rib cage like that, that's really not an ideal position. You want to make sure to keep that rib cage down, nice and neutral, press, boom, and it should not move, right? Fault, okay. Cool, so that's the one joint rule. Next one is our bracing technique. So bracing technique is what we use to stabilize our spine. It's the musculature we use. So the one we're talking about here is the transverse abdominis. So you have two main muscles around your abdomen. You have your transverse abdominis, which runs this way around your waist. And then you also have your rectus abdominis, which is on the outer portion of that runs up and down. So those muscles, the six pack, all that stuff you see, that's your rectus abdominis that is showing. Your transverse abdominis is behind that, and again, it runs this way. So this is we want to train our transverse abdominis to get really stable, really strong, and be able to support our body, or our back really, when we're lifting. Now, if you guys seen weight belts, what guys wear at the gym for weight belts, how they kind of go around this way, well, that's replicating your transverse abdominis to support your spine. But we want to do that internally with our own musculature. So, a little bracing technique that I go through. Again, remember breath as we went through in the previous video. We want to keep on breathing. To really activate and find that transverse abdominis if you guys haven't. So I'm going to do it, I'm going to exaggerate it. I want you to suck in your stomach as much as you can. Okay, and now push or hit that muscle that's really sucking it in, that's your transverse abdominis. So, just so you know that's firing and that's where that's at. So what I like to do to get warmed up and to kind of activate it is take a deep breath in, calm breath out, neutral, boom, activate that transverse abdominis. That you sucked in, you know what that muscle is. Again, breathe in, out, boom, activate that transverse abdominis. So you see right here on neutral, squatting down, transverse abdominis is activated, right? Sometimes when I'm training, I will go to a person, and as they're in that squat position, if they're neutral, if they're where they want to be in a position, I will just hit their stomach a little bit, just tap it, make sure that is active. So one thing to think about when you are not activating that, right? So I can be in a squat, and for instance, let's say we're just squatting a kettlebell, and I'm down here, boom, transverse abdominis is active. If I turn it off, well, it actually does make the lift easier in a way, because if my transverse abdominis is not working there, right, I can hold this position and it's not active, or I can squat with it and my transverse abdominis is not active, right? But again, we want to train it to be active when you're lifting in all these lifts. So what happens is, yes, it's easier if you don't activate it, so you kind of have to think with intention when you're doing a lot of these things, and that's where our cues will be coming into you guys. We're cueing you guys, making sure you guys are activating. I'm always saying breathing, bracing, make sure you're doing those as we're walking in class. These are just cues, you'll hear me say them a lot. So going back to that point, if you're not bracing and if you're not activating that transverse abdominis, well, you know what, that load that you're lifting, the load is still there. You're having to use some kind of a tissue to hold that load up here. So if you're not activating your transverse abdominis and actively using muscle, well, guess where it's going? Right to your spine, probably on ligaments and joints you don't want to be using because those are just to hold your bones in place. So we do not want to put the lift, the weight of all of these lifts on those passive tissues. We really want to put them on the musculature where they're meant to be. So again, guys, this is important in terms of activating it. And I'll tell you, it will make the workouts, the kettlebell swings, squats, deadlifts, whatever you guys are doing, it will make them harder. But the more that you train that, and the more you train your transverse abdominis to be active, the better you are, and the more you'll stay away from injury and performing as you want to be. So, yeah, so it's the one joint rule and bracing technique.